Hi, I'm Ted Mitchell, Senior Account Manager at Optum RX. Welcome to your 2025 Prescription Benefit Overview. This presentation is intended for members utilizing the prescription benefits offered by the Michigan Public School Employees Retirement System as administered by Optum RX. This presentation is for non-Medicare eligible members. To assist you in finding information quickly, the presentation has been divided into sections. The presentation will focus on the following areas of interest. 2025 plan updates will highlight the changes for 2025. Key terms and cost share provides helpful definitions and explains your cost share and annual coinsurance maximum. Maximizing the value of your plan. This section covers cost-effective drugs, home delivery, specialty pharmacy, and more. Helpful resources. We'll cover information about digital tools and member communications. Finally, how to contact Optum RX. We will now discuss the 2025 plan update for non-Medicare eligible members. In 2025, non-Medicare members will have more options to save when filling prescriptions through Optum Home Delivery. When using a coupon card, members will receive credit towards their annual out-of-pocket maximum for the amount of a drug copay that they actually pay out of pocket. All other aspects of your plan remain unchanged. In this section, we will focus on your out-of-pocket costs for 2025 by discussing your benefit basics, and we'll delve into helping you to understand some key terms and cost share. To understand your cost share, it is important to be familiar with certain key terms that I will be referring to throughout this section. Tier determines the medication costs. The lower the tier, the lower the cost of the medication, and the lower the cost share that you will be responsible for. The higher the tier, the higher the cost of the medication, and that means that the cost share for you would also increase. Cost share. The share of costs of a covered drug is the amount or percentage that you would be responsible for. This term includes coinsurance and copayments or similar charges. Coinsurance. This is the percentage of cost that you are responsible for and is determined by tier placement. For example, the coinsurance for a generic and preferred brand medication is 20%, up to $45 for a 30-day fill at a network pharmacy. Annual coinsurance maximum. The annual drug coinsurance maximum limits the amount you pay for covered medications until you reach the coinsurance maximum. Formulary. A list of prescription drugs covered by your prescription drug plan or another insurance plan offering prescription drug benefits. This is sometimes referred to as a drug list. Maintenance drug. A prescribed medication that is taken over an extended period for an ongoing or recurring condition is a maintenance drug. Examples of these include medications or drugs taken for blood pressure or diabetes. Specialty drug. High-cost medications that are not generally available at a retail pharmacy are considered specialty drugs or medications. Medications are defined as specialty if they require ongoing clinical oversight and extra education, have unique storage or shipping needs, may not be available at retail pharmacies, and some specialty drugs may be administered through injection, inhalation, or require infusion. Let's look at the 2025 cost share for non-Medicare members. For Tier 1 generic and Tier 2 preferred brand name drugs, your cost share is 20%. This coinsurance includes a $15 minimum copay and a $45 maximum copay per 31-day supply. The 90-day coinsurance includes a $37.50 minimum copay and a $112.50 maximum copay. A 90-day fill of a generic or preferred brand name drug is your best value. For Tier 3 non-preferred brand drugs, the cost share is 40%. This coinsurance is combined with a $15 minimum copay and no maximum per 31-day supply. A 90-day supply minimum copay is $37.50. Please note that Tier 3 non-preferred brand drugs do not have a maximum copay. All specialty medications are classified as Tier 4 and Tier 5 and are broken into two categories. Tier 4 preferred specialty and Tier 5 non-preferred specialty. Tier 4 preferred specialty drugs have a coinsurance of 20% with a $50 minimum copay and up to a $100 maximum copay per 30-day supply. All Tier 5 non-preferred specialty medications have a 40% coinsurance with a $50 minimum copay and no maximum per 30-day supply. Specialty medications dispensed outside of Optum Specialty Pharmacy will have the non-preferred coinsurance of 40% with a $50 minimum copay and no maximum copay per 31-day supply. Specialty medications are limited to a 30-day supply. Let's take a moment to discuss copay minimums and maximums. Here's how it works until you reach the annual coinsurance maximum. If the drug cost is less than the per drug minimum, you would pay the total cost of the drug. When the drug price exceeds the plan minimum, you pay a percentage of the drug price up to the plan maximum. For Tier 1 generic drugs and Tier 2 preferred brand drugs, if the drug price for a 31-day supply is greater than your plan minimum of $15, you will pay for 20% of the drug cost up to the $45 maximum. The plan would cover the remaining cost. There is no plan maximum for non-preferred drugs and specialty drugs purchased from a non-preferred or out-of-network pharmacy. The annual coinsurance maximum protects you financially by limiting the amount you pay for medications per calendar year. There is no change to your annual coinsurance maximum. It remains $1,750 for calendar year 2025. You pay 20% for Tier 1 generic and Tier 2 preferred brand drugs. The minimum is $15 and the maximum is $45. When you use generic or preferred brand drugs, the full amount you pay is applied to your annual coinsurance maximum. When you reach the annual $1,750 coinsurance maximum, you pay $0 for the remainder of the calendar year. You pay 40% for Tier 3 non-preferred brand drugs and there is no maximum. Only 20% up to the $45 plan maximum is applied to the annual coinsurance maximum. After the annual coinsurance maximum of $1,750 is met, members using a non-preferred brand and specialty products will still be required to pay a copay. The copay will be reduced by 20% up to the plan maximum. When you reach the annual $1,750 coinsurance maximum, you pay $0 for the remainder of the calendar year. For Tier 4 preferred specialty drugs, you pay 20% up to the $100 maximum. The full amount you pay is applied to the annual coinsurance maximum. When you reach the annual $1,750 coinsurance maximum, you pay $0 for the remainder of the calendar year. For Tier 5 non-preferred specialty drugs, you pay 40%. Only 20% up to the $45 plan maximum is applied to the annual coinsurance maximum. After the coinsurance maximum of $1,750 is met, members using a non-preferred brand and specialty products will still be required to pay a copay. The copay will be reduced by 20% up to the plan maximum. This also applies to all specialty medications dispensed outside of Optum Specialty Pharmacy. Let's take a look at a 90-day copay example for a generic or preferred brand name drug. Reminder, the member cost share is 20%. The 90-day coinsurance includes a $37.50 minimum copay and a $112.50 maximum copay. A pharmacy retail price of $1,000 per 90-day supply is only $112.50 member cost share, and the full amount goes towards the annual coinsurance maximum. Now let's look at a 90-day non-preferred brand drug copay example. Reminder, the member cost share is 40%. The 90-day coinsurance includes a $37.50 minimum copay with no maximum copay. A pharmacy retail price of $1,000 per 90-day supply is a $400 member cost share, but only $112.50 or the amount equivalent to the Tier 1 and 2 cost share is applied to the annual coinsurance maximum. This example is for a 30-day supply for a preferred specialty brand medication. Reminder, the member cost share is 20%. The 30-day coinsurance includes a $50 minimum and a $100 maximum. A pharmacy retail price of $3,000 per 30-day supply is only $100 member cost share, and the full amount that you pay goes towards the annual coinsurance maximum. Your cost share will be impacted if not filled through an in-network specialty pharmacy. This example is for a 30-day non-preferred specialty medication. Reminder, the member cost share is 40%. The 30-day coinsurance includes a $50 minimum copay with no maximum. A pharmacy retail price of $3,000 per 30-day supply is a $1,200 member cost share, but only $45, or the amount equivalent to the Tier 1 and 2 cost share, is applied to the annual coinsurance maximum. Let's turn our attention to how Optum RX can help you receive the most value from your pharmacy benefit. Going generic maximizes cost savings for you and the plan. Generic drugs are at Tier 1 and are often a less expensive alternative to brand name. Generics are drugs that have the same active ingredients as brand name medications and work in the same way. When a patent on a brand medication expires, it can be marketed as a generic. Since generics have been around a long time, their safety and efficacy has been proven and they are value priced to save you the most money. On average, generics will provide an 85% savings over the brand name counterpart. Ask your doctor or pharmacist, is there a generic or lower cost alternative that is right for me? Staying preferred is the next best option if a generic is not available or is not quite right for you. Use our digital tools to discuss pricing with your doctor to see what works best and is the most cost-effective for you. The quantity of medication that you fill affects what you pay. When you have an acute condition like a sinus infection, you will generally receive a 30-day supply of a drug. However, when treating an ongoing condition with a maintenance medication, a 90-day supply is in most cases a better value. Maintenance drugs are those taken on a regular basis to treat chronic conditions such as high cholesterol, high blood pressure, or diabetes. 90-day supplies are recommended for when therapy plans are already defined and tested. If you are working with your doctor to determine what dosage and strength will work best for you, we recommend 30-day supplies during this learning period to avoid waste. Once you and your health team have determined the dosing regimen that is best suited for you, 90-day fills offer a more cost-effective and convenient way to access your maintenance medications. Retail pharmacy drug prices can vary. Some retail pharmacies have in-store programs that may offer additional savings. You can find a nearby retail pharmacy by using the pharmacy locator tool at www.optumrx.com or on the mobile app. You may also call the phone number on your member ID card. Optum Home Delivery offers retirement system members many advantages when compared to walk-in or retail pharmacies. These advantages include affordability. When using Optum Home Delivery, you may pay less for your medication with a 90-day supply. Easy and simple. Get your medications without leaving home with free standard shipping. Members that use home delivery are less likely to have unintended breaks in medication therapy or miss a refill. Patient advocacy. Speak to a pharmacist who can answer your questions anytime, any day. You may also set up text and email reminders to help you remember to take or refill your medications. Optum Specialty Pharmacy does more than fill your prescription. With Optum Specialty Pharmacy, you have access to expert clinicians by phone 24 hours a day. Extra support is available through Optum Specialty Pharmacy's medication and condition-specific programs. Added savings and lower costs for specialty medication may be available when you use Optum Specialty Pharmacy. Dividos is a full-service pharmacy that is convenient, saves time, and provides personalized delivery of your prescription medications, vitamins, and supplements that are sorted by day, date, and time. Dividos offers extra convenience by working with your doctor and insurance so you stay on track with refills and won't run out of what you need. Save time with free delivery and have your DiviBox delivered right to your door. Your personalized custom box will contain pre-sorted pill packets for all of your medications, vitamins, and supplements. Using Optum RX's powerful digital tools, you can get help and answers to your questions with just a few clicks. The Optum RX digital tools are a convenient way for you to manage your benefit. They are easy to use and allow you to access your information whenever you need to and make the most of your pharmacy benefit. In order to access these tools, register at www.optumrx.com using your name, date of birth, address, phone number, and member ID. Using www.optumrx.com is fast, easy, and secure. On our website, you can compare medication prices at different pharmacies, locate a network pharmacy, manage medication for covered dependents and spouses, and view real-time benefits and claims history. When you use Optum Home Delivery, you can use the member portal to transfer retail prescriptions to Optum Home Delivery, track orders, and refill Optum Home Delivery prescriptions. When you log into the Optum RX member portal at the top of the screen, you will see the dashboard. It displays important information all in one spot. We'll review each of the tabs at the top of the page and provide you with what information can be accessed through clicking on each of the tabs. On the top far left, you will see Quick Actions. By clicking here, you can see alerts, order notices, and reminders for things like renewing or refilling a prescription. With one click, you are able to check out, easily renew or request a refill from your provider, all from a mobile device, tablet, or computer. You may complete these common actions below in 3 clicks or less. Refill a prescription, track an order, price a drug, and view benefits and claims. With the My Prescriptions tab, we've made managing your prescription simple. You can easily view a listing of current and past medications from Optum Home Delivery, retail, and over-the-counter. If you need to reorder an older prescription, you'll save time as past medications are listed for simple searching. The Order Status tab provides real-time order tracking and keeps you informed as your orders are being processed. The Order Processing tab shows when an order has been received, processed, shipped, and delivered. Real-time order tracking notifies you when an order is on hold, the reason for the hold, and what is needed to resolve the hold to prevent delays. You can receive order refills via email or text without having to sign in. To set this up, select a preferred method of communication on the website. Then you will be able to act on any notification that you receive. The drug pricing and information function on Member Tools allows you to search for drug information, alternatives, and price a drug using our intuitive pricing technology within a few clicks. You can be prepared and keep things moving by identifying if a prior authorization or step therapy is required in the prescription drug list. The Pharmacy Locator allows you to see in-network pharmacy locations within your area. The Information Center offers more than just forms. It's an online resource that provides trusted information. You will find claims, home delivery, physician facts, and other forms, FAQs, and other details about your benefits and processes, important updates from the FDA, and information from reputable sourced articles. Claims and projected cost information are now available at your fingertips. You can access accumulator summaries, cost-sharing requirements, and expected out-of-pocket costs. Under claims history, you can see what the plan covered and what you will be charged and what you have paid. If there is an opportunity to save on that medication, an alert will detail how. If a medication requires a prior authorization, you can request it. This will allow your order to continue without delay. Last but not least, being able to locate all of your claims in one location can also make it easier for you at tax time. You can modify your profile and program options to fit your lifestyle. From the My Profile page, you will be able to manage communication preferences, reminder notifications, or even go green and reduce paper by switching to email communications. Set up personalized reminders or optional text alerts. Manage accounts, passwords, and addresses. If you are going south for the winter, you can make a one-time shipping address change. And opt in or out of Optum Home Delivery, automatic refills, and more. Optum RX makes it easy for you to get documents related to your benefits by email. These include information on your benefit and plan information, claim summary, explanation of benefits, billing and payments, pharmacy care information, and tax documents. You are eligible to request electronic delivery by email through Optum RX's member website. If you choose to do this, you will get an email each month informing you that your claim summary is ready to view online. Now let's talk about the Optum RX mobile application. The Optum RX mobile app offers a lot of the same features as www.optumrx.com. No more searching. With a couple clicks, you will have access to tools to manage your orders, connect with care providers, find cost-saving options, and make informed decisions by searching reliable information from a trusted source from anywhere at any time from your smartphone. The dashboard displays important information all in one spot. This includes alerts, order notices, and actions to take, such as renewing or refilling. With one-click checkout, you can easily renew or request a refill from your provider from your mobile device. Before you even leave the doctor's office, you can track your order status or the price of a drug. At any time, you can click on your cart and check out. The updated consumer-friendly user interface makes it easy for you to manage your account without having to call customer service. Real-time order status prevents delays and keeps your orders moving. Order now. This allows you to quickly add any refillable medication to your cart and check out in just a few clicks. Order status tracks where your order is every step of the way from any device and keeps it moving. Simply select the order you want to track, and a visual image will show you at what stage of the fulfillment your order is at. You can easily access the medication order number, date, when it was delivered, and cost. The order processing page. It provides real-time information on when an order has been received, processed, shipped, and delivered. It also displays the reason if there is anything additional required and what action you should take to remove the hold. Drug pricing is fluid and changes daily. This can make it challenging to price medications or even understand all the different places to look. We are committed to making it easier for you to find the best price for medications right when you need it. Whether you're at the doctor's office, the pharmacy, home or work, online or on the phone. The Optum RX mobile app provides real-time pricing that's available anytime, anywhere through a simple and secure digital member portal. Just like the Optum RX website, when you use the mobile app, managing your prescriptions is easy. You are able to view a listing of current and past medications for home delivery, retail, and over-the-counter. If you need to reorder an older prescription, you'll save time as past medications are listed for simple searching. Automatic prescription refilling helps keep you on your medication schedule so you are never out of your medication. It eliminates the need for you to remember to request a refill and narrows the chance of missing a dose, which can be harmful to your health. Never miss a medication again with refill reminders and push notifications. These are sent to you and automatically open the app so you can take action. Automated reminders makes tracking adherence and refilling medications simple. The mobile app empowers you to research everything, from drug side effects to common uses. With better information at your fingertips, you can make more knowledgeable healthcare decisions. In the Information Center, you can find forms for home delivery, physician facts, and other forms, reputable videos, FAQs, and other details about your benefits and processes, important updates from the FDA, and more. Thank you for listening to this Optum RX presentation. If you have any questions, please contact Optum RX by calling the number on the back of your member card, 866-288-5209, and your questions will be answered. Customer service agents are available 24/7. You can also visit the member portal at www.optumrx.com. Please remember to visit the Optum RX kiosk in the Learning Center for additional information. We hope that you find this overview of your prescription benefit plan to be of value. Thank you.